Welcome to our Healthcare Analytics Hot Topics webinar. Before we get started, I would like to remind you to mute your lines until the end of the discussion. We will open up the conversation at the end of the webinar for questions and comments. I would like to introduce our speaker for today, Anna Daly. Anna Daly is a healthcare informatics professional with an extensive background in clinical data, business intelligence, and health information technology management. As both vendor and business owner, Anna has played an integral role in developing and leading clinical warehousing and BI initiatives for some of the largest healthcare systems in the U.S. Her specialties include data governance, government and healthcare operations, and clinical-based research reporting and analytics. Ms. Daly received her Bachelor of Science from Harding University and her Nursing and Masters of Science Nursing Informatics from Vanderbilt University. She also serves as the Adjunct Professor of Healthcare Informatics for Belmont University in Nashville, Tennessee.
I'd like to thank everyone for joining the call today. Today we will be discussing some current hot topics within the healthcare analytics space. At the end of the presentation, as we stated earlier, you will have the opportunity to ask questions and learn how you can contact Pandera Systems for further information. So let's get started. Reviewing the agenda we have for today, we're going to walk through three specific topics. First is defining your population health strategy for accountable care, which includes principles that can also be applied to quality reporting, regulatory compliance, and claims management. Our second topic of discussion will look at how to improve patient outcomes and performance utilizing real-time analytics and monitoring. Our third topic will discuss creating physician performance tools to help drive patient care and satisfaction. And finally, we will briefly touch on self-service analytics and data governance to entice you to join our third webinar in the series, Healthcare Analytics Future Trends, that I will be presenting in November. Population health leaders need to focus on the data and information that will increasingly power clinical decisions. Ultimately, in order to achieve competitive advantage in your IT investments, you must be able to use the wealth of information at your disposal to deliver information-powered care to patients in real time. You're going to need more regular access to information about your patient's global health status. Ongoing access to and analysis of patient health information is the key to providing proactive, preventative care. Start thinking in terms of managing your populations using personalized information to create individual, customized care plans and reimbursement models for payment and coordinated care. Then add a retrospective analysis to proactively act in real time to prevent adverse events and increase workflow challenges. At Pandera, we have been looking at ways to better manage patient populations across the continuum of care. We begin by pushing beyond the four walls of the hospital and working with our clients to identify current challenges in defining and managing various populations. One of our recent clients was dealing with poor patient outcomes and satisfaction scores, as well as difficulty in maintaining process improvements within new staff initiatives. Many providers also struggle to maintain overall performance levels in the face of rapidly changing regulatory guidelines pertaining to quality outcomes. Helping build a population health strategy for reporting helps enable your organization to monitor your engagements based on defined criteria and protocols, and then align those with company goals for performance. It also opens the door to redefining and implementing a population-based strategy that will maintain ever-increasing competition and reduce patient leakage rates through coordination of care and case management principles. Population health concepts represent a change in the focus from the individual level, characteristic of most mainstream medicines, and seeks to complement the efforts of public health agencies by addressing a broader range of factors shown to impact the health of different populations, with the aim of reducing health inequities or disparities among population groups. By developing a population health strategy, your organization can realize benefits that can generate actionable reports to help care teams identify gaps in care, better manage chronic conditions, and optimize pre- and post-visits. All derived from evidence-based guidelines allowing for communication with patients who are overdue for preventative and/or chronic care services. Some potential benefits from these population health management strategies include dynamically defined metrics providing trend analysis alongside past performance and current factors, identifying areas of opportunity at the point of impact, rank and index clinical outcomes based on user-defined protocols, being able to track compliance with treatment protocols. It also allows for format reporting on demand to match the needed level of detail, whether it be a high-level executive report or an analyst deep dive. And also improved management of patient populations, patient throughput, and staff workflow. Pandera Systems provides tools that help healthcare providers refine workflow processes at the point of impact to improve patient outcomes and to enrich patient satisfaction, which leads to greater success for the entire organization. Based on the client's challenges identified earlier, we were able to increase visibility into high-impact quality areas of the organization based on evidence-based protocols and practices and service agreements. Aggregation of transactional, clinical, and operation data to enable a broader picture of organizational health. Produce trend analysis and identify areas of opportunity based on defined quality and performance metrics, again defined by the clinical and business users. And finally, create visualizations and alerts to drive process improvements and better outcomes through easy-to-read and absorbable scorecards, dashboards, and reports. Results of your implementation strategy vary on a case-by-case basis. For the Pandera client used in this case study, they were also able to realize a 50% improvement in quality across opportunity areas, resulting in a $4 million savings from outcome improvements. They noticed improved compliance in near real time. They were able to reduce risk by managing now, not retrospectively. And it also allowed them to be prepared as an organization for the rollout of ACO-based operational models. Our hot topic number 2 is real-time analytics. The emergence of practice models that tie reimbursements to patient outcomes and patient satisfaction makes practice oversight vital to building and maintaining a successful practice. Clinical staff typically perceive monitoring tools as irrelevant, ineffective, or not helpful, so adoption rates are typically very low. Most monitoring tools rely on claims data, which is often 30, 60, 90 days old. The lack of recent data makes it difficult to coach clinical staff on areas of opportunity due to fading memories and high-volume patient throughput. A lack of visibility to peer performance further lessens the usefulness of monitoring applications because performance issues are not visible in the context of the overall practice performance. Solutions are also not available on mobile platforms, so access to the information is inconvenient. The challenge in our real-time analytics hot topic comes from the urgent care industry, an area of medicine driven by patient volumes and strong workflow processes. Our clients were looking for the ability to review clinic performance based on defined volumes or workloads, the ability to drive patient wait time and staff productivity efficiently. They wanted to be able to monitor patient volumes to goals across the organization in real time, and be able to identify financial drivers dependent upon staff workflow and process. By identifying potential benefits to be gleaned from a BI solution early in the project, our urgent care clients were able to stay focused and define processes to custom configure the centers in their network in organizational groupings, allow for administrator access level security to define their own users, drill through to procedures performed and satisfaction scores, break down all their staff performances by area and trend that over time, as well as customization of metrics and thresholds based on specialty and practice. Pandera Systems collaborated with our urgent care provider partners to drive consistency across their practices with solutions that promote data transparency, staff collaboration, and alignment to organizational goals to improve patient outcomes and patient satisfaction. We implemented patient throughput and clinic activity monitoring using real-time touchscreen or motion sensor displays that are visible anywhere within the clinic. We increase physician performance and engagement with RVU or volume tracking and interactive scheduling applications that allow the physicians to manage their own clinic workloads. We integrated with wearable technology for instant management of patient activity or missed clinic targets, and it was provided for all clinic and operational executives. We built to allow administrative users full access control of metrics, thresholds, and aggregation so they could be in control of their own application. Results of our real-time use case allowed for clinic owners and managers to increase their visibility into a multi-site organization and self-defined benchmarks in real time for increased transparency. Performance and workflow practices were streamlined, and a feedback loop for continual process improvement and staff satisfaction was implemented to meet the client's motto of "Make it easy, make it awesome." Using gamification techniques and the natural competitive tendencies of physicians, we developed a ranking system for clinic performance by RVU or volume. We also enabled comparisons against peer groups or clinic organizations. We also created clinic-defined patient satisfaction surveys and scores that are visualized across time and benchmarked against the organization. For our hot topic number 3, we're looking at physician performance tools. With the advent of performance-based reimbursement models, we have increased the pressure on healthcare providers to continually improve patient outcomes and patient satisfaction scores. We're also faced with a greater accountability for the quality of care provided to feed current trends of consumerization in healthcare. Being able to incorporate clinical, operational, and financial data into a single reporting platform to measure physicians and staff performance has become an imperative to a successful clinic practice to bring true transparency into your organization. Monitoring and trending physician performance is the proverbial elephant in the room that no one wants to discuss, yet is required to achieve peak performance of your organizational goals and align with patient quality standards. Physicians are often reticent to share and compare performance challenges with management, relying many times on anecdotal information or third-party review of activities. Introducing a near real-time physician performance tool changes the conversation by making data available to all physicians and all clinicians at multiple levels of the organization and truly enabling visibility and accountability of your staff. Adoption rates for current staff performance tools are often low due to a number of factors, including lack of current data to analyze physician performance when they're forced to use data that is 60 to 90 days old. Lack of customization. Most out-of-the-box tools do not fit every need, specialty, or service line. Clinicians work in a multitude of different areas, and they need special customization by clinic and practice need. A lack of mobility tools. Tool selections must grow and expand to fit into the physician's workflow, and they must be able to be available outside the four walls of the hospital or clinic to truly be successful. The potential benefits for implementing a physician performance tool are numerous. Productivity monitoring tools by Pandera Systems are role-based, relationship-based, and customizable by specialty and service line. Staff members are ranked and indexed relative to peers and organizational benchmarks. Pandera's product suite features a wide array of mobility features, including alert monitoring via text message and email, as well as full support of iOS and Android mobile platforms. As I stated before, visibility brought forth by physician performance tools changes the conversation between management and staff. Each group can be level set on a shared understanding of their data and allowing themselves to work quickly through discrepancies and perceptions in performance, as well as quality outcomes. The client solution created by Pandera within this use case was exclusively built on a mobility platform. This platform enabled increased visibility into high-impact quality areas of the organization. It also aggregated the transactional, clinical, and operational data for all areas of the organization. We produced trend analysis to identify areas of opportunity based on defined quality and performance metrics, and allowed benchmarks to be defined by the individual clinic based on their workflow and client mix. We used visualization and alerts to drive process improvements and better outcomes, including the use of wearable technology and touch-free screens. The results of the Pandera client collaboration included motivated discussions among clinicians and physicians regarding practice opportunities utilizing social media formats for feedback and knowledge transfer. They looked at case studies, industry peer reviews, and real-time news feeds. We facilitated physician input for remediation plans by bringing that visibility into the performance metrics calculations and peer comparisons. And patient satisfaction reporting was available on demand, utilizing patient satisfaction surveys at the end of every encounter to improve ability of leadership and staff to address performance issues and identify areas of opportunity at the time of the occurrence. This increases patient retention and reduces patient leakage. All of our hot topic areas are also challenged by a lack of interoperability among the best-of-breed systems that undermine leadership's ability to develop true population and real-time operational strategies. Today, approximately 70% of clinical data is textual or document-based and therefore unavailable via traditional reporting. This incomplete reporting can lead to lower reimbursement rates, poor utilization of staffing resources, and an inability to effectively control costs. Many of our healthcare organizations rely on a patchwork of network systems to support their various departments and initiatives. Clinical, financial, and administrative data reside in silos across organizations, and staff members often have no way to cross-reference this information for their benefit. By knocking down these silos of information and aggregating the data contained in them, Pandera can help you utilize the full potential of your data and improve capacity and service line planning for resource utilization and staffing models, improve pricing and contract development for future business, and improve your quality and your compliance performance across the continuum of care. Introducing self-service analytics into your BI reporting strategy can open up a world of data to your business units and provide a clean and simple way for your users to answer their own questions without the aid of IT or a third-party vendor. Business needs typically don't change much over time, but what does change is the technology used, the data that's available to them, and the cultural or expertise of the information use. Business users are hungry for and now require access to data for decision making without having to go through technology experts each time they have a new question. Business users are now more BI savvy, having myriad tools allowing them to gather information from multiple sources, analyze it, and share it with others without having to know the technical protocols required to access that data. And then the governance of this information's use is of critical importance to define checks and balances on data preparation and its use. Pandera Systems has developed a self-service business intelligence platform to help you structure your reporting initiatives and allow your business and clinical users to answer those simple questions. It also devises an ad hoc strategy for promotion of ideas and to scale those ideas across your enterprise in order to meet your ever-changing reporting needs with visibility and accountability. We can help you empower your business users with the tools and concepts that they need to develop and vet ideas in a safe environment. We can also help implement and govern a single metric dictionary source and then apply a wash, rinse, repeat process to roll this out across your enterprise, allowing for consistent and tailored reports. Whether you're looking to implement a population health management strategy, introduce real-time analytic reporting, or roll out a physician implementation tool, we at Pandera can help you to strategically engineer your business environment to optimize decision-making. We mobilize and extend your intelligence, immersing every employee in knowledge. We create evolving ecosystems for enterprise-wide alignment and decision continuity, and focus and purpose to produce peak performance and ongoing success for every client. Success with your data is predictable and left only to your imagination as how far it can take you. That concludes our webinar for today. Thank you for joining us. If you have any questions or would like to speak to a Pandera account manager regarding service offerings, please contact us at info@panderasystems.com or visit our website at panderasystems.com. Thank you for your time today, and I look forward to speaking with you during our final healthcare webinar in November titled Healthcare Analytics: What is in Your Future?